Coming back for test results, is it appropriate or can we bill insurance when a patient comes back to have their TB test read? I think that's bundled in.
It's bundled in, I'm pretty sure. But a real quick way to find that out is just jump out and Google it. But I am almost positive it's bundled because usually you are just coming in to see the nurse and they take a look at your arm and you're out of there. The documentation and everything has all been filled out already in the initial visit, and they literally just sign off and say, yes, it's clear. So just, I don't want to say common sense because that's not the right thing to say, but what we know about bundling off the top of my head, I could pretty confidently tell you it's bundled. Now, if it reads positive, that's a different story because then they have to go in and have you do a chest x-ray. You're probably going to see the provider and, so they will set up a visit for that. And that would be a little bit different of a scenario. But if they just come in and read it, Joanne probably could have told us confidently off the top of her head. Did you find anything in the Google?
Yeah. There's some issues about billing a 99211.
Okay, Catherine.
99211 is go ahead. Someone had an answer.
Catherine says we billed the plant, which I think she means the injection. The read is included.
Right. Okay.
Yeah.
All right, but we can maybe do some separate research and back that up. But yeah, that's the initial off-the-cuff answer.
Do you need more medical certification and business training? Learn more at www.cco.us.